So our cancer program is basically, it's a comprehensive program. For our community, we really start from diagnosing the disease, ensuring patients have the right biopsy, the right diagnosis on time, no delays.
So we think about the patients. We think about the fact that these patients have a huge shock to their system, both mentally and physically. And we try to make it as easy as possible so they don't have to think about the technical side of it. So they don't have to worry about other things. They can just worry about getting better.
As the doctor was speaking, the only word that I really could hear was cancer, and I could not hear anything else.
All of this was, at best, an anxious time, and at worst, very frightening.
Once the patient is suspected to have a cancer, we take this very seriously. We arrange with our radiology department to do the scans patients need on time, usually in the same day or next day.
I think when a patient gets diagnosed with cancer and they hear that cancer word, they block out a lot of things. It takes a while to get beyond that word. There's all the stages that a patient goes through, fear, denial, why me? Are they going to be able to continue their job? What are the side effects going to be? And you try to not ambush them with all this information at once. You just listen to them, try to answer their questions.
Every patient is different. Every person is different. So we take our cues from them.
I usually tell my patient, I advise and you decide, I guide and you decide. I don't decide for my patient. So what I'm doing is providing my patients with the best standard of care, the best medicine we have and we know, and let the patient decide for themselves.
Like Dr. Ghanem, he would always, I'd ask him a question and he says, no questions are silly. There's always unanswered questions. Just ask anything.
Dr. Ghanem and everyone has always been just the sort of support that you would want anybody to have going through a situation like this.
The patients have their own lives, they have their own families, they have their own financial situations. You don't assume the patient will do what you order them. Usually I discuss with my patient, understand their background, their financial situation, their social situation, and then come up with a plan with the patient and let the patient decide what they want, instead of I just tell them what they need to do.
And patients do like Dr. Ghanem. He's compassionate. He's very intelligent. I only hear good things from patients about him, and I feel the same way.
And I do too.
He always takes my hand, and he has such a nice warm hand. And if I don't catch what he said, he'll repeat. And like I say, he's very patient. And then when he leaves, he takes my hand again, and he smiles all the time, and he has dimples. Yeah, I'm real happy with him.
Working in Washington, D.C. is a challenge because you work on all these big places where they do a lot of research and you see different variety of malignancy and cancer. I was exposed to a lot of these really big names in medical oncology and hematology in the National Institute of Health in Georgetown and in Johns Hopkins.
One of the things that Aspirus has allowed us to do is look at the population at Aspirus Keweenaw, Aspirus Ontonagon, Aspirus Grandview, and we're able to bring in a very high quality hematologist oncologist that is attracted to a large program where Ontonagon by itself could not support an oncologist. It just couldn't. And even Aspirus Keweenaw by itself would struggle to make that a reality. But by combining multiple institutions, you have a larger population base, and it allows us to bring in good quality people in the oncology program to do that.
I had been feeling tired and sort of drained for a while, but I thought it was just, getting older and working a lot and just not having all the pep and everything that I had had before. But then about a year ago, it seemed to be getting worse, and I had a near fainting episode in town. And I called my regular doctor and set up an appointment. And during the course of all the blood work and everything, she was concerned that there might be some blood issues going on. So she referred me to Dr. Ghanem.
The new era of oncology, when we treat patients, we try to give them the most effective and the least toxic treatment. We really care a lot about quality of life issues. Doesn't mean you have a cancer that you should be in the emergency room every day and you should be sick. That's not the case. The case is you should administer to the patient the most effective treatment you can give but the least toxic one. You should really ask the patient about what they do at home, what they do after hours. Do they sleep or not? Do they communicate? Do they socialize or not? Do they go to restaurants or not? Do they have their own daily life activities or not? It's not about just giving the patient chemotherapy and let them go home and doesn't matter what happened to them after that.
We also give other injections that can help prevent some untoward reactions from chemotherapy. So we try to avoid as many side effects as possible. I used to tell a patient of ours, whenever I brought the chemotherapy up to the floor, I used to tell a patient of ours that we make all of the chemotherapy with love. Sounds corny, but it was just always a nice thing to talk about with our patient. And I always told her that we'd put a little something extra in the drug for her.
When I had my chemotherapy in the infusion center here at Aspirus Keweenaw, they explained every process, all the processes that they did, explained exactly what chemo was, what the side effects would be, what I might feel, what I may not feel, what could happen. They were very kind and compassionate and explained everything, which was absolutely wonderful.
Every cancer patient should be treated as a whole, not as just a number. You read the patient's psychology, you read the patient's social life, you read the patient community connection, and then you put the treatment in context of all these things together. You don't just administer treatment. So it's not acceptable that your patient is very sick and you just keep giving them chemotherapy. This is why I always look at a cancer patient as a healthy individual who need more advanced treatment rather than a patient who will be dying soon and we should just give up on them. When I started, I thought the first thing I need to do is to build a good team. I worked with the administration at Aspirus and asked them to provide me with the best resources they have. We started with a good nursing team, infusion center, which was really set up in a good way to help our patients.
They made a point of making sure that my husband was comfortable with what was going on, that his questions were answered. During the course of my chemotherapy, he was there all the time with me. The nurses in the infusion unit made sure he was comfortable, that if he had any questions, he was encouraged to ask. And he didn't have to go and sit out in the waiting room. When there were chairs available, he could sit with me. And that was much more comfortable for him. So everybody made sure that not only my questions were taken care of and my concerns, but they took care of my husband too.
We are part of the hospital, but it doesn't have to be real clinical, and
Comfortable chairs, the television, there's Wi-Fi here.
we feed them lunch.
Yes.
Yep.
A good lunch.
Yeah.
My position is more of a case manager for each of our patients. Most of the time, I'm gathering information before I even meet the patient, and I follow each patient through that first visit.
We are oftentimes able to see a patient on Monday and able to give chemotherapy on Tuesday afternoon. So there's a quick turnaround once a diagnosis is made and treatment plans are determined.
We work with lab, we work with x-ray, Dr. Ghanem, Michelle.
Well, we're definitely a team,
Definitely.
and we work well together.
When you see your patients are trying their best to get the treatment they need, and they're fighting so hard this disease, then I get inspired. Every day when I go to work, I just think about my patients and think what is the best way to help them. You will be surprised how people in this area are strong. They're really willing to do what it needs to fight this disease, and they're doing a great job in this, and they deserve the best care, and this is what inspires me every day.
Patients, survivors, they come here, they drop in to say hi to me, to update me on how well things are going, and that really is nice that they remember and have smiles on their face, and we get hugs, and what good care we gave, and that's nice.
Cancer is an aggressive disease, and just having the diagnosis or someone tell you have a cancer itself change all your life. If someone else did it, you can do it. Look in your community. You will see a lot of survivors around you.
So we do a lot of things together.
Yes, and we have memories, don't we?
We do.
Nice memories.
Yes, we do. High fives all around.
I've called it an adventure at times because it's new and I've learned a lot. And I've met some wonderful people. They've all done such a wonderful job helping me get to this point where 3 months after I finished my chemotherapy, I'm now considered cancer-free. I can start focusing on regaining my strength so that we can do things this summer. Plan on seeing family. I can start thinking about the future again, not just the immediate future, but 6 months down the road, a year down the road. They've got me to the point where I've got my life back.
Actually, when you talk about a new lease on life, I was just having a discussion with my wife. She was talking about this one individual who has been very resistant to medical care over a long period of time. The individual was diagnosed as having cancer and underwent treatment here at Aspirus Keweenaw. He had surgery first of all, and then underwent chemotherapy, and is now back for a 6-month and a 12-month post-treatment check. And I'll tell you, I had my wife comment this is the best that she has seen him look in 20 years. He has completely turned his life around. He's active. He's out doing his gardens, and very honestly, if you didn't have a program here in town that he could have participated in, I have absolutely no doubt that he would not have undergone the treatment.
And I cannot be ever so thankful to be alive and for everything that everybody here has done for me. You have given me a second chance on life.